Hi, appendicitis is inflammation of the appendix. Symptoms commonly include right lower abdominal pain, nausea, vomiting, decreased appetite, and fever. Sometimes feces gets collected in the hollow portion of the appendix. This is called a fecolith. Now, this fecolith eventually becomes calcified and leads to blockage of the appendix. Inflamed lymphoid tissues from viral infection, parasites, as well as gallstones or tumors may also cause the blockage. Now, this blockage leads to increased pressures in the appendix, decreased blood flow to the tissues of the appendix, and bacterial growth inside the appendix, and this leads to inflammation. The combination of inflammation, reduced blood flow to the appendix, and distention of the appendix causes tissue injury and eventually tissue death. If this process is left untreated, the appendix may rupture, releasing bacteria into the abdominal cavity, leading to increased complications including sepsis. As the appendix becomes more swollen and inflamed, it begins to irritate the adjoining abdominal wall. This leads to the localization of pain in the right lower quadrant. The abdominal wall becomes very sensitive to gentle pressures on palpation. There is also severe pain on sudden release of deep pressure in the lower abdomen. This is called rebound tenderness. The appendix could be in a retrococcal position. This means that it is localized behind the cecum. Therefore, deep pressure in the right lower quadrant may fail to elicit tenderness, and this is called a silent appendix. This is because the cecum, which is now distended with gas, protects the inflamed appendix from pressure. Similarly, if the appendix lies entirely within the pelvis, there is usually complete absence of abdominal rigidity. In such cases, a digital rectal examination elicits tenderness in the rectovesical pouch. Now let's look at the pathophysiology of appendicitis. Now, primary obstruction of the appendix is an important factor in the development of appendicitis. Once this obstruction occurs, the appendix becomes filled with mucus and swells up. This continued production of mucus leads to increased pressures within the lumen and the walls of the appendix. The increased pressure results in thrombosis and occlusion of the small vessels, as well as stasis of lymphatic flow. At this point, spontaneous recovery rarely occurs. As the occlusion of blood vessels progresses, the appendix becomes ischemic and necrotic. As bacteria begin to leak out of the dying walls, pus forms within and around the appendix, and this is called suppuration. The end result is rupture of the appendix, causing peritonitis, which may lead to sepsis and eventually death. Diagnosis of appendicitis is based on a complete medical history and physical examination. An elevated white blood cell count denotes an inflammation due to an infection. However, this is less specific and therefore cannot be relied upon. Imaging studies could also be done. In a typical history, the combination of pain, anorexia, leukocytosis, and fever is classic. Atypical histories often require imaging with ultrasound or CT scan. Now, CT scan has been shown to be more accurate than ultrasound in detecting acute appendicitis. However, ultrasound may be the preferred option or the first imaging test in children and pregnant women because of the risks associated with radiation exposure from CT scans. Now let's look at the clinical signs associated with appendicitis. In culture sign, the start of pain according to the patient's history is in the umbilical region with subsequent shift to the right iliac region. In Bartholomew-Michelson sign, there is increased pain on palpation at the right iliac region as the person or the patient being examined lies on his or her left side compared to when he or she lies on the back or lies supine. In Dunphy sign, there is pain in the right lower quadrant with coughing. The standard treatment for acute appendicitis is surgical removal of the appendix. This may be done by an open incision in the abdomen, also known as a laparotomy, or it could be done through a few smaller incisions with the help of cameras, which is also known as laparoscopy. Surgery decreases the risk of side effects or death associated with ruptured appendix. Antibiotics may be equally effective in certain cases of non-complicated or non-ruptured appendix. However, there is a possibility of recurrence within a year, which would eventually require an appendectomy. Most people with appendicitis recover easily after surgical treatment, but complications can occur if treatment is delayed or if peritonitis occurs. Thanks for watching. Please like this video and subscribe to the channel. More videos coming up. See you in the next one.